Let's review. All subjects. Category is Name that syndrome. Part 6. Ready? Good luck. A triad of medullary carcinoma of the thyroid, pheochromocytoma, and parathyroid hyperplasia. Sipple syndrome. Common hepatic duct obstruction caused by extrinsic compression from an impacted stone in the cystic duct or infundibulum of the gallbladder. Mirizzi syndrome. Neurodevelopmental disorders caused by a deletion of a region in the paternal chromosome 15. Prader-Willi syndrome. Oligomenorrhea, anovulation, hirsutism, obesity. Polycystic ovarian syndrome. Occurs when tumor cells release their contents into the bloodstream, either spontaneously or in response to therapy, leading to the characteristic findings of hyperuricemia, hyperkalemia, hyperphosphatemia, and hypocalcemia. Tumor Lysis syndrome. Disorder characterized by acute dilatation of the colon in the absence of an anatomic lesion that obstructs the flow of intestinal contents. Ogilvie's syndrome. Functional bowel disease with GI symptoms unexplained after normal investigations. Irritable bowel syndrome. The unexplained death, usually during sleep, of a seemingly healthy baby less than 1 year old. Sudden infant death syndrome. An acute, diffuse, inflammatory form of lung injury and life-threatening condition in seriously ill patients, characterized by poor oxygenation, pulmonary infiltrates, and acute onset. Acute respiratory distress syndrome. Rare form of acute encephalopathy and fatty infiltration of the liver that tends to occur after some acute viral infections, particularly when salicylates are used. Reye syndrome. Abrupt, transient loss of consciousness due to a sudden but pronounced decrease in the cardiac output. Stokes-Adams Syndrome. Areflexia, lower extremity weakness, saddle anesthesia, fecal incontinence, urinary retention. Cauda Equina syndrome. Neurodevelopmental disorders caused by a deletion of a region in the maternal chromosome 15. Angelman Syndrome. Obstruction of superior vena cava causing neck and facial swelling. Superior vena cava syndrome. Antibodies against presynaptic calcium channels at neuromuscular junction, associated with small cell lung cancer. Lambert-Eaton Syndrome. How did you fare? Subscribe for more.